Okay, go.
Hi, good afternoon, everybody. My name is Dr. Roger Tsai, and today I wanted to speak with you guys about some other common questions and maybe some misconceptions about breast augmentation. So, I have a list of about 10 questions I will go through, and if you guys have any questions, you can go ahead and type in your questions, and I'll answer them for them as we do this live feed. So, first question I have is, what is the recovery period, and what can I expect, and what kind of help will I need during my recovery? So the recovery period varies from patient to patient. I would say the vast majority of patients, 90% or more, will probably only need about 2 or 3 days of recovery. Most patients do their surgeries, on a Friday, and they can go back to work on a Monday if they wanted to take use of the weekends. Basically, it's not a lot of very sharp pain. It's more of this dull pressure pain, almost like an elephant sitting on the chest, due to the amount of pressure and depending on the volume that we put in. Again, it will vary from patient to patient. Some patients have a higher pain tolerance. Some patients have a lower pain tolerance. I actually have some patients that go out to the movies and dinner the night of even, and I have some patients who maybe take 3 or 4 days to recover. So it just really depends on the situation and each patient to patient. But I would say, again, 90% or more, or the vast majority of patients, within about 2 or 3 days, they should be feeling pretty normal enough to go back to work and do normal daily activities. As far as what kind of help you'll need during the recovery, again, it's only about the first 2 or 3 days where it's going to be a little bit uncomfortable, especially the first 24 hours after anesthesia. The patients are going to be a little bit loopy and not going to really have too much of a balance, only because of the medication that's given to put the patient to sleep. So for the first 24 hours, you might need some help around the house, somebody to help you get up and out of the bed, maybe help you move around a little bit. But after that, you should be able to do things on your own. Alright, so the second question is, what is the incision site and size? So that's why it's very important to come in for a consultation in person. There's many different incision sites. I personally like to do one of two ways. The one of two ways I like to do is the one around the areola or underneath the breast tissue. These are the only two incisions that gives the surgeons a direct visualization of the field. If there's any bleeding, if there's any issues going on, it's easier to control. There are two other ways you can do breast augmentations. Is through the armpit and through the belly button. Those are becoming a little less common, as they're what we call blind procedures. These pockets are made through incisions that are far away from where you need to be. So a lot of times you can't see exactly what you're dissecting, you can't see what's going on. If there's a little bit of bleeding, you can't really control it. So there's a lot more complications that come through those other two incisions. Therefore, I pretty much personally stick with the two incisions that are more of what we call a direct visualization of the breast. And so I can form the pocket, release the muscle in a more appropriate way, and place the implant exactly where I want. As far as the size is concerned, again, each patient's different. Some patients want to go 2 or 3 cup sizes. Some patients want to go 1 cup size. So as far as the size is concerned, it really just depends on the patient. So in that situation, it really depends on. It's important to come in for a consultation so that your goals can be reviewed and we can find the size that's perfect for yourself. Again, the sizes, it gets kind of complicated because there's many different what we call profiles. There's high profile implants that give you more of the fuller look. There's moderate profiles that give you more of the softer natural look. And again, there's silicone versus saline, which I'll go over here in a little bit as well. So the next question I have is implant placement above or below the muscle. So again, this is not that it's tricky, but it's very patient dependent as well. Most of the patients I see are very thin, and therefore I recommend going underneath the muscle. I would say the vast majority of surgeons also go underneath the muscle for a couple of different reasons. For me specifically, number one, by placing the implant underneath the muscle, the risk of what we call capsular contracture, which is one of the bigger complication, not really a complication, but one of the bigger things that happens after surgery, which is where the scar tissue kind of forms around the implant, is significantly less underneath the muscle. Number two, which I think is also very important, is again because I have a lot of very thin patients that come in to get breast augmentation. If you have a thin patient and you're putting the implant just underneath the skin and the breast tissue, there's a very thin layer covering the implant. If I'm allowed to put it underneath the muscle, now I have a thicker layer of tissue that covers the implant. Therefore, you have less implant show, less rippling, and the implant feels more natural. The breast feels a lot more natural. So I personally am a fan of placing it underneath the muscle for those situations. However, if I have a patient that comes in with very thick breast tissue, I think the standards are 2 centimeters or more. Then it's possible to place it above the muscle. But again, just realize that the difference is, there's advantages and disadvantages of each. In one, by placing it above the muscle, you don't have to do a lot of muscle dissection. But again, there's chances of more rippling, more implant show, and not quite as natural or softer feel. Whereas placing it underneath the muscle, the disadvantage is that we do have to release the muscle a little bit, even though in the long term there's not really any strength loss or functional loss. But the advantage is aesthetically, it could be a little bit nicer. Next question, how often do they have to replace the implants? Okay, so I'm sure as a lot of you've heard, every so-called 10 years implants need to be replaced. I personally think that's, again, patient to patient. I have had patients who've had implants in for 30 or 40 years, never had issues with them. I've had patients who've had them in for 5 or 6 years and had issues with them. So this varies. I don't think there's a set number or a time that that the breast implant needs to be replaced. I think what happens is within around 10 years or so, the patient usually undergoes some kind of body or physical change, whether the patient gets pregnant, whether there's weight gain or weight loss. Basically, over 10 years, the breast sometimes gets a little bit more droopier, they don't look quite as nice, or the implant sometimes gets malpositioned, and patients desire to have the look that they had 10 years ago. And so, around 10 years or so, a lot of patients do end up coming to get a revision or something done. But honestly, if there's no issues with the breast implant, if you like how they look and they're fine, there's no indication to touch them or do anything to them unless you personally don't like how they look or if there's an issue with the implant themselves. Next question, what's the difference between saline and silicone implants? Okay, so saline implants are basically sterilized water placed into a silicone shell, and a silicone implant uses the same shell, but it's made, a gel, a silicone gel is placed into the implant and it's manufactured before they come into our office, whereas with the saline we actually infuse the water into the implant as we perform the surgery. So what's the advantages and disadvantages of both implants? The saline implant, again, in order to counteract some of the rippling, the saline implant tends to be a little bit more overfilled. So a lot of times, if you have like a 300 cc implant, you generally overfill it by 10%, so about 330 or so. The reason you do that is because saline implants tend to ripple more, and so by overinflating an implant, you prevent the rippling. But what happens is, if you can imagine an overinflated balloon, it's more round, more circular, more firm. And so with a saline implant, you tend to have this more round, exotic look, more firm appearance. That also, in the end, tends to ripple a little bit more. However, the advantage of a saline implant is that the saline implant were to rupture or burst, the sterilized water that we place in there is absorbed through the body. Again, it's very safe-free. It's the same liquid that they put through the IV if you go to the emergency department or even in the hospital. So very safe liquid. Your body can absorb it, no big deal, and you'll see an immediate deflation of the implant. And then you'll know there's an issue with the implant, so that's an advantage. Talking about silicone implants, it's the exact opposite. So the disadvantage with a silicone implant is that if it does rupture or there's an issue with the implant, a lot of patients don't really know there's something going on. The only way to diagnose these issues is to get an MRI. However, many insurance companies won't cover a routine MRI just to look for breast implants, so a lot of times patients have to pay out of their pocket, which could be several thousands of dollars just to see if there's an issue with the implant. However, to counteract this disadvantage, the implant companies have made a more what they call cohesive implant. I'm sure you guys have heard of the whole gummy bear implants that the implant companies are making. They are what we call a cohesive implant, to where they don't really leak like they did back in the days. Back before, it almost leaked like it was gravy. It went through the body. Sometimes gets a little bit absorbed, which obviously wasn't the best. But the implants these days, the new generation implants, don't really leak anymore. They kind of stay within the pocket, and so that's their way of fixing this disadvantage. The advantage of a silicone implant, however, though, is manifold. As far as if you're more interested in aesthetics, is you're a softer, more natural look. It feels also softer and more natural, and you don't get quite as much rippling. If you're to ask me, I'm personally a bigger fan of the silicone implant because it does look a little bit nicer. Again, it looks more natural. It feels more natural, but again, the way you choose an implant depends on the patient's personal goals and desires. So I also do a lot of saline implants for those who want more of a fuller look, but again, this all really depends on each individual patient's preferences. You know if you are a good candidate for a breast augmentation. Again, a lot of that kind of is determined when you come in for a consultation, and that's why the consultations in person are very, very important. You know, if you're in good health, you know, if you're looking for a modest increase in size of the breast, you know, you're pretty much in a good realm of being a good candidate for breast augmentation. If you have any other issues going on with the breast, then there might be other, you know, conditions that we need to talk about. But again, if you're healthy, no other medical issues, no breast issues, and you're looking for a, you know, modest increase in breast volume, most patients are candidates for breast augmentation. My next question here is, let's see, will my ability to breastfeed be affected? So, they've done many studies in our journal throughout the last couple of years, and they've showed that breast augmentation does not cause any deficiencies in breastfeeding. What's important to know is the last statistics that I saw, around 40 to 60% of women in the country can't breastfeed to start off with already. And so they've done studies where they've done a control study of women who didn't have breast implants and a control study of women who had breast implants, and they found that the percentages were pretty much exactly the same. So statistically, there's no correlation between patients who've had breast implants and the inability to breastfeed. But a lot of women sometimes blame the breast augmentation for having breast augmentation for not being able to breastfeed, when in fact, again, the literature shows that almost half of the women out there, even more than half the women out there, can't breastfeed to start off with already, and there might be other issues going on, such as anxiety, stress, and other environmental factors that can cause this to happen. But with the procedure itself, you know, just knowing how it's done, you're not cutting through a lot of the breast tissue, breast ducts, and things like that. So the ability itself to breastfeed shouldn't be affected. Next question. How will my breasts look if I choose to have the implants removed in the future without replacement? Very, very good question, because oftentimes you have to think about what's going to happen 20, 50, and 30 years down the road. It's a little bit tricky to answer, because what happens is when you place breast implants in, what patients have to realize is the skin ends up being stretched out. Almost like when patients are pregnant and they're breastfeeding, the breasts are engorged. You know, when the breast ends up shrinking down, they have this loose extra skin. Same exact thing is going to happen with a patient with breast implants, except, you know, breastfeeding is only, you know, so many months, maybe a year or two, whereas when you have the implants in, it's sometimes decades. So imagine the skin being stretched out for decades. Once the implant is removed, the skin will retract to a certain extent. However, it never retracts to the point of what it looks like originally. So it is very important to realize that, and you know, patients often go two ways. Some patients just don't like the implants; they have them taken out. The breast tissue contracts to a certain point, but a lot of these patients are a little bit older and they don't really care about how full or how big their breasts are. And some patients are happy just with an explantation where they just take the implant out, let the tissue seal, and be on their way. However, for the kind of younger crowd, the younger generation, or sorry, the younger patients who really still want that nice full breasts, unfortunately, you will have to put in a new implant. However, there's another option. Basically, we need to fill the volume. So whether it's an implant or some other material, you need to fill the volume, or you need to cut out the extra skin. So one of two ways: you can do a breast lift, which cuts out the skin. By cutting out the skin, you won't have as much of the droopiness. However, the volume might not quite be there. If you still, again, want that full perky breast, you're going to need either an implant or something called fat grafting. If patients have enough fat in their torso, sides, thighs, arms, whatever areas, what you can do is you can actually liposuction those areas and inject the fat into their breast in order to provide the volume that you need. So one of two ways: either an implant or a fat grafting will provide the volume, and a breast lift will remove the extra skin. And my next, and it looks like probably the last question for now, is will they explode if I do get on an airplane? So they won't explode. Again, if they're done correctly. I have heard of a story of a patient, maybe through a TV show or something, where, and again, I don't know if it's even true or not, where a patient got on the airplane and their breast implants exploded. Well, to tell you for sure, the silicone implants won't explode. The saline implants won't explode as well. The reason this particular story, if it's true, apparently, is that they went to somewhere out of the country. They didn't really fill the implants with the correct material. There were a lot of gases in the material that they placed, and with the high altitude and the pressure, the gases kind of came out of the liquid form and created more volume in the implant than needed, and the implant exploded. So if you do it correctly, you go to a board-certified surgeon, and they put in the correct material, that shouldn't happen. Again, this one isolated incident, again, if it was a true story, when they did the research, or when you dig deeper, it's because they didn't go to the correct person, and they didn't fill the implants with the correct materials. Again, if you go to another country or go internationally, there's not quite as many stringent rules or regulations as they do in the United States. So that's why a lot of doctors are very wary about patients going overseas, because you don't know what you're getting. And again, there's no rules or regulations in those countries, whereas there's lots of rules and regulations in this country, and therefore your care is better. So I think that's all the questions I have for now. Did anybody ask any questions?
Someone asked, how long would surgery take?
Surgery is usually about an hour. The technical portion from start to finish. It takes about a good 15 or 20 minutes to go to sleep, and maybe about a good hour to recover. So the entire duration of everything may be about 2 or 3 hours, depending how quickly you recover. But the surgical procedure itself, from start to close, within an hour. Anything else? Okay. Well, we'll keep continuing to do this Q&A live updates here and there, so continue to follow us, and if you have any questions, feel free to reach out.